first started Rounds, I was absolutely terrified. It is a terrifying thing to stand in front of, 100 or so of your colleagues and begin to do something that nobody really wants to do in the healthcare service, which is to explore feelings. And actually, I've been completely shocked and surprised by the way people have responded and reacted to that in such a positive way.
One of the things I was concerned about was, what would people think of me getting involved in something which was all about emotions and feelings rather than about hard clinical facts and dealing with patients. And I don't think it's had any adverse impact at all. And I think in many ways it's been really quite good, because I think people are looking at me thinking, well, actually, usually I'm into education and training, and the fact that I'm doing this is a bit different, but it puts it up there with education and training.
So it's seeing the impact outside of the rounds that I have found surprising and has convinced me more and more of the value.
One of the most moving things is actually hearing people talk quite honestly about some of the difficulties they've had, or some of the hard things they had to do at work, and just seeing how honestly the kind of audience respond, and the ability of the audience, or of all of us, to be able to support each other.
I've certainly witnessed lots of very, very senior clinicians who've been very closed, actually, really emotionally closed, and they've done that to defend themselves in this work that they do. And I think the rounds have enabled them to just open up a little bit, and to open up in front of colleagues. They've really been able to model to colleagues about how it is to just be very honest about the work that we do and how difficult it can be.
Dealing with skepticism is an ongoing thing. What was interesting is one of the particular consultants I remember saying, I don't know whether I'm going to go along there, what do you expect us to do? Vent our spleens, burst into tears. But they came to the first one, and they've come to the second one, and they're interested in putting a case forward for future ones as well. So I think skepticism is a lot easier perhaps to deal with than I feared.